So we are looking at another section of the hospital, which is very important, and most hospitals in Africa actually lack this. But in an ideal hospital, we are supposed to have a neonatal intensive care unit. Now, we'll get to talk about how a neonatal intensive care unit ideally it should be, the things that should be found there, and all of that. So neonatal intensive care unit is just a specialized hospital unit. So they design it to actually care for newborn babies who maybe have been born prematurely, or maybe they gave birth to the baby had low weight. Now we are just talking about it on the surface. Of course, many things are bringing these abnormalities, or maybe the baby has faced some serious health challenges at birth. You can't go and be admitting the baby together with adults, but most hospitals in Africa, they usually combine neonatal intensive care unit. They just put it in under pediatrics. It's not a special unit like that. Do you understand? So definition is a highly specialized area in the hospital equipped with advanced technology. You know that these people are little humans, you get. So their care is supposed to always be special. So it's equipped with advanced technology staffed by trained professionals to care for babies that are critically ill, premature babies. So purpose: you want to stabilize and support newborns whose organs are underdeveloped or who have medical complications that require intensive monitoring and treatment. So who needs this care? So maybe babies admitted for various reasons. Maybe like the baby was giving birth to before time, So you want to console the baby that, sorry, I didn't allow you enjoy the intrauterine space to the fullest, So low birth weight too. The baby is under 2.5 kg. Birth difficulties, that's breathing difficulties, respiratory distress syndrome, infections or sepsis, congenital anomalies or birth defects, neonatal jaundice or hypoglycemia, complications during delivery, like the baby had little oxygen reaching them, So what we got, who works in this place? We have this group of people, neonatologists. Okay, those ones are pediatric specialists. Okay, so they're specialized in newborn care. All right, you have the nurses. Those ones are trained to monitor and care for fragile infants. Respiratory therapists, pharmacists, and dietitians. Those ones who know medications, the right food to eat. Occupational and physical therapists, social workers, and counselors. Right, so we have levels. Level 1, description. Okay, level and description. Right, level 1 is basic care for healthy newborns. Level 2 is special care for moderately ill or premature babies. Level 3, intensive care for very sick and very premature infants. Level 4 is the highest level, offering surgical and complex care.